Hello everyone and welcome to week number 3. For week number 3 we will be focusing on otology or the ears. So we only have one chapter this week for you guys to read and discuss, and that's going to be chapter 39, pages 895 to 902. So let's go ahead and get started. So chapter 39 is talking about the study of hearing, which is also known as otology. The providers working and specializing in the ears are called otologists or otorhinolaryngologists. Those are individuals who work with the ears, nose, and throat. The ear is the organ of hearing and balance. Most parts of the ear are internal and are protected by the temporal bone of the skull. We use instruments to examine the ears such as the otoscope, tuning fork, and odometer. The otoscope is a lighted instrument used to examine the tympanic membrane. A tuning fork is a metal fork-shaped instrument that produces a vibration when struck, and that vibrating instrument is then held near the patient's ear or placed on the head to give them a rough hearing assessment. An odometer is an electronic instrument that measures more frequencies or the number of fluctuations per second of energy in the form of sound waves. When a patient indicates their ability to hear with the odometer, a recording is made on what we call an otogram. So now that we kind of understand how we test for the ears and the structures of the ears, there are a few more items that we need to talk about that medical assistants are responsible for. Two of those things are ear irrigations and installing ear medications. But first we need to talk about when you're looking at the ears and you're documenting for ears, what are some of the abbreviations that are approved for you to use? So just like when we talked about the abbreviations for the eye, we also have the ones for the ear. They are AD, AS, and AU. AD is right ear, AS is left ear, and AU is both ears. You may also hear terms used such as otic, that's typically for ear medications. If you see the word otic, that means that it is strictly for the ear. That is not a medication that can go into the eye. Although when you hear the word ophthalmic for medications, that is actually can be used in both eyes and ears. So just be careful when you see medications and you're reading the labels fully to make sure that you don't mess that up. And also so for the patients to be safe and not have any sort of problems in the end. So when we were talking about ear irrigations, this is done and is necessary to help us remove impacted earwax or serum. But we can also use it if maybe there's some sort of foreign object stuck in the ear canal. Typically, children like to put things in their ears and in their nose, so sometimes we have to go in and flush those out. When you do an ear irrigation, you use warm water and a syringe to insert into the patient's ear. You can also use some hydrogen peroxide to help loosen up some of the earwax if it is in fact impacted. You will need to have access to the patient's ear canal, and we do this by pulling on the ear. Now, if you have a child who is 3 and under, you want to pull the earlobe down and towards the back, but if they are 3 and older, you will want to pull the earlobe at the top up and to the back. Another reason that we might have to do an ear irrigation is patients have what is called tinnitus. And tinnitus is known as ringing in their ears. This can happen sometimes if they do have impacted earwax that's sitting on that eardrum itself. Ear installations are the next thing that we'll talk about. And when you're installing ear medications, again, this is something just like the eye medications. You can do it in the office or actually instruct the patient on how to do this at home. It's really important for parents, especially if small children, to learn how to do ear installations as they will be the ones responsible for doing these when the child is at home. You want to make sure that the patient is laying down. Typically this seems to go better, or they can sit with their head tilted. Either way, the affected ear needs to have the head tilted away from it. So as you can see in this example in the picture, the patient's left ear is the one that needs to be up towards the top, so it's easier for the parent or the medical assistant to access. Again, you'll want to have access to that ear canal, so follow the rules. If they're 3 and younger, you will pull the earlobe down into the back. If they are an adult or 3 and older, you will want to pull the earlobe up into the back. Now, when you go to place the medication in, you want to avoid touching the dropper to the actual ear canal itself. You want to place it about a half an inch to an inch above the ear canal, and make sure you only put in the appropriate amount of drops. Don't overdo the drops. After you've placed the correct amount of drops in, you'll want to have the patient stay with their head tilted or laying down for about 3 to 5 minutes. If you let them get up too soon, it can cause dizziness because we've actually put something into their ear canal, and as I said earlier, the ear is responsible for not only hearing, but also your balance. All right, so that's kind of a quick, brief overview that I have for all of you on Chapter 39. Please make sure that you are still reading the pages in total, as this will help you with your lab classes for the week. It will help you with your quiz for the week and your discussion board. Speaking of your discussion board, this week we are focusing on hearing impairments. You will need to discuss whether people with hearing impairments can work and compete in technical or scientific fields. You will need to explain why they can or why they cannot. That is really important. Don't skip that step. You will need to explain some of the challenges that people will face with hearing impairments and what are some resources that could be used to help them if they are needed. Please remember that initial discussion posts are always due on Tuesdays. So this due date is October 17th by midnight. And you need to have at least one reply post to a classmate no later than Saturday, October 22nd at midnight. Lastly, you will have a quiz again this week, and it will be over modules 2 and 3, so that's the eyes and the ears. So you'll have to go back to module 2 and take a look at that as well. It is a 10-question, which is all multiple choice. You'll have a 10-minute time limit. So please don't forget that your quiz will be due no later than Sunday, October 23rd at midnight. If you guys have any questions or concerns, please reach out to me either via email or phone. And I hope you guys have a great week 3. Bye, everybody.